Do you have a child or do you have plans to have one? If your answer is yes, join me as I delve into respiratory distress in children and educate you on when to rush your child to the nearest health facility. Let's delve in. In simple terms, respiratory distress is a condition where the body needs more oxygen. It can cause rapid breathing, difficult breathing, and low oxygen levels in the blood. Respiratory distress is when a child has many signs and symptoms of breathing problems. Infections, chronic illness, or a blocked airway can cause respiratory distress. Children who are born early or premature or have been in the hospital for respiratory problems may be at greater risk. When your child has to work hard to breathe, it can mean they are not getting enough oxygen to the lungs or are starting to get an infection. To know if your child may be in respiratory distress, look for the following signs and symptoms. Pale or bluish skin color. Check around the lips, eyes, hands and feet, especially the nail beds. Increased breathing rate. Count the number of breaths for 1 minute. Is your child breathing faster than usual? Retractions. Check to see if the chest pulls in with each breath, especially around the collarbone and the ribs. Nasal flaring. Check to see if the nose holes or nostril widen when breathing in. Noisy breathing. Listen for breathing that sounds like grunting, the U sound, wheezing, or like mucus is in the throat. Clammy skin. Feel your child's skin to see if it's cool but also sweaty. The head may be sweaty while the skin feels cool or clammy. Mood change. Check to see if your child is sleepier, has problem waking up, is fussier than usual, or is just not acting like themselves. Change in body position. Your child may change their position to try to breathe easier, like leaning forward or tilting their head up or backwards. Call the doctor or healthcare provider if your child shows any of the following signs of respiratory distress. Has fever or low temperature. That is when your child has a rectal temperature over 100.4 Fahrenheit or 38 degrees Celsius. Again, when your child is younger than 4 months and has a temperature less than 96.5 Fahrenheit or 35.8 degrees Celsius. Under the arm or axillary temperature is more than 103 Fahrenheit or 39.4 degrees Celsius if older than 4 months. In the mouth, the oral temperature is over 102 Fahrenheit or 38.9 degrees Celsius for 3 days or higher than 104 Fahrenheit or 40 degrees Celsius if older than 4 years. Again, call the doctor or healthcare provider if your child has a cough and phlegm or drainage that is thick and yellowish green in color. You have to note that not all breathing problems can be avoided. You can help prevent respiratory infections by taking these steps. 1. Do not smoke around your child or in places they go, even when they are not there. Children who are around smokers get 2 times as many respiratory infections and colds as those who don't live with smokers. Smoke residue can build up on surfaces in rooms and cars. 2. Keep places where your child will be dust-free. 3. Do not use baby powder or cornstarch on your child. These things can irritate the lungs. 4. Everyone in the house should practice good hand washing to keep germs from spreading. 5. If you can, keep your child away from people who are sick. By following these preventive measures, you can safely prevent your child from most respiratory infections. Thank you for watching. I really hope this helps you and your family. Don't forget to hit the like button and the subscribe button. Until next time, stay safe.